adjustments that are needed. Check medication order against physician order according to agency policy. Clarify any inconsistencies. Check patient chart for allergies. Know the actions, spatial nursing consideration, safe dose ranges, purpose of administration, and adverse effect. Consider appropriateness of medication for the patient. Perform hand hygiene. Move medication outside of the patient room or prepare for administration in the medication area. Unlock the medication cart. Prepare medication at one patient at a time. Read the mark sheets and select proper medication. Compare the label with the MAR and check for expiration date and perform calculation if necessary. When all medication have been prepared, recheck the label with the MAR before taking them to patient. Lock the medication cart before leaving it. Transport medication to the patient bedside carefully and always keep the medication inside. The patient received medication at correct time. Identify the patient. Check the name and identification on the patient identification band. If the patient cannot identify herself, verify the patient's significant others. Before administering medication, check allergy bracelet or ask the patient allergy. And explain the purpose and action of the medication. Perform hand hygiene and put on gloves. Provide patient with paper tissue and ask patient to blow her nose. Have the patient sit up with head tilted well back. If the patient is lying down, tilt head back over with a pillow. Throw a sufficient solution into a dropper for both nares. Do not return excess solution to stock bottles. Ask the patient to breathe through the mouth, hold the tip of the nose and place the dropper above the nares above 1/3 of an inch. Instill prescribed number of the drop in nares and then into other. Protect dropper with a piece of soft tubing if the patient is an infant or young. Avoid touching nares with dropper. Have the patient remain in position with head tilted back for a few minutes. Remove gloves and perform hand hygiene. Assist the patient to a comfortable position. Evaluate patient response to the procedure and the medication. Document procedure into the patient chart.